So after performing an EKG, what you will notice is after your rhythm strip prints out, it's going to give you a duplicate reading of lead 2. And so you can see here, you have lead 2, and then you also have at the bottom of your rhythm strip a consistent read of just lead 2. The reason behind that is because lead 2 is normally used to interpret the rhythm and will provide the clearest recording of a heart rhythm. Now let's take a look at some of the artifacts and abnormal rhythms that you might see. So just by definition, artifacts are going to be abnormal findings due to improper technique, poor conduction, or outside interference. Some of those abnormal rhythms or artifacts could be somatic tremors, an AC interference, wandering baseline, or Starting with our artifacts, this represents what you might see with someone who has a somatic tremor. Now, with a somatic tremor, it's defined by erratic spikes at the baseline, and that's exactly what you see here. Also, when you think about a somatic tremor, you might find it helpful to think of someone who may be shaking. Here we have shivering patients or patients that have Parkinson's, or maybe that do suffer from tremors. Those tremors are going to cause an artifact in the reading where you will see where the patient is shaking along the rhythm strip. Best thing to do for a somatic tremor would be to possibly take the patient and secure them with a blanket. If it's a tremor, if they're cold, we can put a blanket around them, wrap it very tightly, take their arms and place them flatly underneath their buttocks. Those will also be great ways to help with preventing the somatic tremor. We just want to help minimize the amount of shaking that the machine picks up so that we can get. So with our next artifact, you have here AC interference. And AC interference is generally caused by an electrical device that may be on or near the patient. Of course, if the patient has a pacemaker or if they have a cell phone that's nearby in their pocket, that could cause an AC interference. Easily identifiable by these uniform spikes and the consistent overriding of the stylus. If you were to witness an AC interference, you'd want to question your patient on devices that may be nearby. And if in fact they did have a cell phone that was close to them, we would take the cell phone and place it away from the EKG machine. That should cause the AC interference to go away and you'll be able to get a normal reading. Here you have the wandering baseline, which is also known as a loose electrode. So we know that our electrodes have a gel substance that allows for the conductivity to happen between the electrode and the electrical activity that's happening there. And sometimes those become loose. So if it's not secure, maybe there's oily skin, maybe there's hair that's causing an interference from the gel being able to have the adhesive that it needs. If that's the case, we're going to go back and evaluate the skin. You might need to remove more hair. You might need to change your electrode and repair the skin a little bit better, vigorously scrubbing with alcohol to remove any lotions or oils. Once that's done and you've evaluated that, you've checked all of your electrodes, you found the loose one, you're going to go in and fix that loose one and rerun your entire EKG reading, and you should see this wandering baseline evenly distribute across one line. So wandering baseline, you can see why it would be identified as wandering. Clearly it's wandering, it's kind of all over the place there. And a typical EKG reading, we would see consistency across one solid line. So replace your lead, check your skin, better prepare the skin, and rerun the test. Interrupted baseline, also an artifact. And interrupted, you can see why it would be defined as interrupted. So demonstrated by a tracing that is not continuous. And not only is it not continuous, but it's not even falling on the same baseline. And so the difference between the wand reading, generally this is going to be connected to a wire that may be broken, or it may be disconnected altogether. So the EKG machine is not able to pick up any activity. Same protocol as if this were a wandering baseline. You're going to go back, check your electrodes, make sure those are properly in place, that the adhesive is in place. And then we're going to look at the wires. Check your wires, make sure you don't have any frayed wires or any broken wires. If you do, you're going to need to replace your entire system there with a new EKG and rerun it. If you have found that maybe it was a lead that was disconnected or an electrode that was loose, you can fix that and rerun the machine as well. And hopefully it'll give you a normal reading.